Do your eyes look puffy, or have you noticed some eye bags under your eyes? If you want to know how to get rid of them, keep watching. This is part 2 of a 2-part video series. In this video, I reviewed at-home treatment options as well as surgical options to treat under eye bags. In case you missed part 1 video of this video series, where I reviewed the causes of puffy eyes and under eye bags, and my 5 tips to prevent them, you can check it out by clicking the link above. For those who are new to my channel, I'm Dr. Audrey Tai, board certified and fellowship trained cataract and refractive surgeon, ophthalmologist, and cornea specialist. Welcome to my channel, Eye Channel by Eye Surgeon. I'm here to bring you the latest information on eye health and medicine. At-home treatment number 1, cold compresses. As I mentioned in part 1 of this video series, fluid retention is one of the most common causes of puffy eyes. So the first at-home treatment you can do is to use cold compresses to reduce the swelling around the eye. One benefit of cold compresses is that cold temperatures can help tighten the skin around the eyes. We have all heard about putting cold cucumber slices over closed eyelids to help reduce eyelid puffiness. But there is a much more effective way that you can harness the power of cold compresses at home than cucumber slices. One of the most effective cold compress methods that I recommend is using thin white potato slices steeped in chilled green tea. The cold cucumber slices do contain antioxidants, but the reason that white potato slices soaked with chilled green tea is more effective is that in addition to the high antioxidant content in the green tea, the caffeine contained in the green tea will help constrict the small blood vessels in the eyelid skin to reduce fluid accumulation in the eyelids. Additionally, white potato slices contain starch, which has an effect of lightening skin pigmentation in the eyelid to reduce the appearance of darkening. Therefore, if your eyes often get puffy when you wake up in the morning, I recommend you make a cup of green tea in the evening and leave it in the fridge to chill overnight. In the morning, you can make some thin white potato slices and soak them in the chilled green tea and leave them on the closed eyelids for about 5 to 10 minutes or so to help reduce the appearance of puffy eyes. If you are short on time, you can either use a spoon that has been chilled in the fridge or a chilled green tea bag and leave that on your eyelid instead for about 5 minutes. It won't be quite as effective as the tea potato method I mentioned earlier, but it will still help reduce eyelid swelling. If you do prefer a cold compress eye mask that fits around the eyes better and is more convenient to use, you can check out the links to the recommended cold compresses in the description below. Number 2, eye creams. There are a lot of cosmetic products out there that claim to be effective for reducing eye puffiness. Do they work? Unfortunately, even though many eye creams claim to reduce eyelid puffiness, most of them are not very effective. I would recommend paying close attention to the ingredients in the eye creams, and for puffy eyes, I recommend picking an eye cream that contains caffeine as an ingredient. As I mentioned, caffeine can constrict the blood vessels in the eyelid and temporarily reduce the fluid retention in the skin, which should provide some temporary improvement in the appearance of the eyelid swelling. I've listed a few examples of eye creams containing caffeine in the description below. If you're just looking for a temporary quick fix, here's what I would recommend. Let's say you have a special event coming up and you need a SOS solution quickly to help solve the eye bags issue just for a few hours. There's an eye serum that is effective in reducing the appearance of eyelid puffiness and eye bags temporarily. The Plexaderm eye serum contains sodium silicate and magnesium aluminum silicate, which are mineral silicate that forms a thin layer over the eyelid and tightens the skin over the eyelids to reduce the eyelid puffiness and wrinkles around the eyes temporarily. It is not a cure, and the effect is not long-lasting. After you remove the eye cream, the tightening effect from the silicate layer is gone. However, it is a temporary quick solution if you're looking for a quick fix for a special event. I've listed the link to the product in the description below so you can check them out. Number 3, blepharoplasty. Cold compresses, eye creams, and serums can only provide limited and temporary improvement to eyelid swelling. and they only work for puffy eyes and under eye bags that are reversible due to fluid retention. None of those solutions will work well for eye bags formed due to the aging process. For eye bags that are formed due to natural aging and the accompanying prolapse of the eyelid fat pads, a surgical procedure called blepharoplasty can be performed to remove the displaced fat pads onto the eyelid, as well as tighten the loose skin around the eyes. This is typically an outpatient procedure and is usually not covered by insurance in the US. The surgery usually takes about 1 to 2 hours or less, and the surgeon may make incisions either through the inside of the eyelid or through outside of the eyelid, depending on the severity of the eye bags. After the surgery, you may experience bruising and swelling of the eyelids for about 2 to 4 weeks. So keep that in mind if you have a big event coming up, so you can plan accordingly for your surgery. You'll be using antibiotics and anti-inflammatory prescription eye ointment on the incisions, as well as prescription eye drops. You will also be doing frequent cold compresses during the postoperative period to help with the recovery process. Number 4, fillers and laser treatments. Besides the surgical option, there are also injectable dermal fillers that can be injected into the eyelid, as well as laser treatments that can tighten the eyelid skin to help reduce the appearance of the eye bags. However, the effect from those treatments is usually not very significant and is also temporary. Therefore, if you're looking for a more permanent and effective treatment to correct eye bags due to natural aging changes, blepharoplasty surgery is usually more effective and longer lasting than the non-surgical options available at this time. Please let me know in the comments below, what treatment have you tried to help with eyelid puffiness and eye bags? I hope you find this video helpful. If so, don't forget to watch part 1 of this video series to learn more about the causes and how to prevent puffy eyes and eye bags from forming in the first place. As always, don't forget to click the subscribe button and turn on the notification bell so you won't miss any of my new videos about eye health. Anytime you don't have 10 minutes, you can watch short fun videos about eye care tips on Instagram at Dr. Audrey Tai. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. I look forward to connecting with you there. Thank you again for watching, and I will see you in my next video.